You know, we're blessed in multiple myeloma. We had what 14, 15 new drugs approved in the last decade. It's not clear that all doctors know all the fine details of these new drugs, how to use them, in which cases. So and look, especially when they're working out in the community, they just don't have time to refresh themselves on the newest treatment. Sometimes they see only a handful of myeloma patients in a given year in their like small clinic. So to keep these doctors on top of these new treatment, these new technology. We have something called minimal residual disease, MRD. It's now been FDA approved. It's there's a technology which is FDA approved, which is reimbursed by Medicare. If you ask the doctor about MRD in myeloma, I would bet you many of them don't even know anything about it. If you ask doctor about next generation, genomic technologies and how those could be of great impact to their patients when they may not have access to such approach, even though even some of them are again are reimbursed by health insurance, or may not even know about these technologies. In CareCloud, that's one of our challenges. We return these reports to the patient and their clinician, and some clinician ask us, so what does that report mean? Not every clinician has been trained as a basic uh, molecular scientist. So absolutely, keeping these our doctors aware of the newest technologies and approach, keeping them also, aware of sometimes the bias they may have. We've talked about disparity. Stem cell transplant in African, in general in the country, 40% of myeloma patients get a stem cell transplant. It's only 20% for African American. Typically, African American don't quite get the same treatments. And there are all kind of reasons for that. And African American don't go on clinical trials very as often. There's reason for that, but part of it is sometimes the lack of information on the part of the clinicians themselves. Um, so I think that's important as well.